Hello everyone. Today we're going to discuss about the osteology of humerus, and this is humerus. Humerus is the long bone of upper limb. It has upper end, shaft and lower end. The most important part in osteology is site determination. So let's get on the site determination. As you can see here, I have two bones, like two long humerus. How do you determine a site? For example, let me take this bone, and here you can see there's an upper end and a lower end. So first thing is, when you see the lower end here, there is a fossa which is called as olecranon fossa, and this fossa is always posterior. So make this bone lie posteriorly. And above there is a head, like the upper end is rounded and this is called as head. That head is mostly always it is medially located like this, and it gets attached to the glenoid cavity above. So when you keep this in the anatomical position like this is the right humerus. And let's see with the other bone here. First, this is the upper end, lower end, and looking for the olecranon fossa which is present posteriorly, turning it on the posterior side of the body. Head is tilted medially and hold it in the anatomical position, like I'm showing you this way, but when you are asked to determine the side of a bone, you must hold it in the anatomical position, facing the head medially and backward, olecranon fossa to be placed posteriorly, and this is the left humerus and this is the right humerus. Let's discuss the parts of the humerus. As you can see here, there's an upper end, shaft and a lower end. Okay, in the upper end you have head. Head is hemispherical and it articulates with the glenoid cavity like this, glenoid cavity of this scapula. And then you have an anatomical neck here. Anatomical neck separates the head from the tubercles. As you can see here, there's a greater tubercle, lesser tubercle and intertubercular sulcus. Intertubercular sulcus is also called as bicipital groove, tendon of the long head of biceps. And what are the muscles getting attached in the bicipital groove? So as you know here, this is the head and this is the medial side of the bone and this is the lateral side. So in the bicipital groove, you call this as lateral lip, floor and medial lip. On the lateral lip, the muscle which gets attached is the pectoralis major, and on the medial lip, the muscle which gets attached is the teres major. And on the floor, the muscle is latissimus dorsi, and you can remember this by lady between the two majors. Here, I said there is an anatomical lip, anatomical neck which separates the head of the humerus from the greater and lesser tubercles. And below the greater and lesser tubercle, there is a narrowest part which is called a surgical neck. And the surgical neck is below the tubercles. And this is the common site of fractures. And there is an axillary nerve around the surgical neck which gets usually injured during giving IM injections. And that's it. Now we'll discuss about the lower end. In the lower end, as I said, this is the medial end and this is the lateral end. And there's a projection on the medial end which is called as medial epicondyle, and this is the lateral epicondyle. On the lateral side, there's capitulum, and this articulates with the radius, like head of the radius. And here, medial to the capitulum, you have trochlea, and this articulates with the ulna. And when you flip the bone backwards, you can see a fossa here, and this is called as olecranon fossa. In the olecranon fossa, the posterior part of the ulna, which is the olecranon process, it gets fixed here, and like this, it moves. So, there are other two fossa. This is the coronoid fossa, and it receives the coronoid process of the olecranon, and this is the radial fossa. This receives the head of the radius during flexion movements. You can remember this by MTC, medial epicondyle, trochlea, coronoid fossa, to avoid confusion. When we're talking about the shaft of the humerus, we'll divide it into two. Like the upper part of the shaft of the humerus is cylindrical and the lower part of the shaft of the humerus is triangular. Okay, and on the upper part of the shaft of the humerus there is a tuberosity which is called as deltoid tuberosity, and this is present on the lateral surface. Okay, there's a tuberosity on the lateral surface which is called as deltoid tuberosity, and deltoid muscle get attached here. And the two important things you need to remember is the deltoid tuberosity and the radial groove. Radial groove is present on the posterior side of the humerus, and then you call it as a spiral groove here, which is present on the posterior side surface. On the spiral groove you have two things: radial nerve and the profunda brachial arteries, and whenever there is a fracture, then that will damage to the radial nerve, leading to wrist drop. Let's revise whatever we have learned. This is the long bone of the upper limb, humerus, and first you have to determine the side and then discuss about the bone. Okay, and as a long bone, it has an upper end, shaft, and lower end. Upper end has head, anatomical neck, surgical neck, and tubercles. Anatomical neck separates the head from the tubercles, and surgical neck separates the lower part of the tubercle and the shaft. On the tubercles, there's great you have greater tubercle and lesser tubercle and intertubercular sulcus, which is called as bicipital groove, because the long the tenor of the long bicep moves from this. It is the content of the bicipital groove. The muscle getting attached to the greater tubercle are supraspinatus, infraspinatus, and teres minor. And on the lesser tubercle, the muscle getting attached is subscapularis. Then we'll discuss about revise about the lower end. In the lower end, there are two epicondyles, medial and lateral. Medial is more larger when compared to the lateral epicondyle. And on the back you have olecranon fossa, and here you have two more fosses. I said you to remember like M, T, C, medial epicondyle, trochlea, and coronoid fossa. Then this becomes capitulum, radial fossa, and lateral epicondyle. All the flexor muscles of the forearm gets originated from the medial epicondyle, and the extensor muscles gets the origination from the lateral epicondyle. And the shaft of the humerus, you have a tuberosity on the lateral side, which is called as deltoid tuberosity, and a radial groove where radial nerve passes. Let's see how it gets attached to the scapula, radius, and ulna. The upper end of the head of the humerus get attached to the glenoid cavity, and it makes a ball and socket type of joint like this. And the lower end, the olecranon process of the ulna fits into the olecranon fossa of the humerus. Okay, and ulna is on the medial side and radius is on the lateral side. And the ulna getting attached to the trochlea, the head of the radius getting attached to the capitulum, and this is the movement. The head of the radius moves into the radial groove, and the coronoid process moves into the coronoid fossa. This concludes the osteology of humerus. Thank you.